Hi everyone, Dr. Remy from Pain Free and Fit and Walk Away Back Pain. Today we're going to be discussing how walking on an incline backwards can be beneficial for disc degeneration, herniation, and bulges. Hope you enjoy. So if you've seen any of our other videos here on the channel about disc degeneration, herniation, and bulges concerning self-corrective exercise to help relieve your pain, you know we've previously talked about the multifidus muscles. The multifidus muscles run from the center of our spine. Each vertebra has its own unique set, and they run down and out to connect other vertebrae. They help to stabilize the spine. They help to decrease the forces that injure and irritate discs. It's been shown in the scientific research that multifidus muscles atrophy or shrink down or become out of shape when we have disc problems, whether you're talking about degeneration, herniation, or bulges. In fact, the greater the nerve compression on that area, the typically more findings of more atrophy in the multifidus muscles. So multifidus atrophy is directly related to nerve compression and symptoms. That's why multifidus training is such a big part of spinal rehabilitation for disc problems. Unfortunately, a lot of us don't have the time or effort to go to separate rehab appointments, to join gyms, to get those workouts in. That's why I developed the Walk Away Back Pain program. It's a great way to use walking, which we all do every day anyway, and just tweak the way we walk and modify our steps and the way we go about walking so that during the day we're actually getting in spinal rehabilitative exercises. We're helping to nourish the disc, we're helping to recenter disc material on the inside of the disc, and we're helping to train the muscles to hold us in a neutral or safe spine that's unique for all of us. So today, we're going to be taking an excerpt from my book, Walk Away Back Pain, and we're going to be combining two ideas to help with chronic disc degeneration, herniation, and bulges. The first idea is walking backwards. Research has shown that as we walk backwards, the multifidus muscles, especially in chronic lower back problems, have an increased activity. That's a way of waking up your multifidus muscles that have been atrophied and problematic and start nourishing them with some good exercise stimulus so they can adapt to that and they can get stronger and start to get back into condition. The other thing we're going to be talking about is walking uphill backwards. If you've seen our previous video on the channel about downhill walking, you know we've talked about how it helps to centralize disc problems. Many disc problems have a tendency to have a posterior backwards migration of the inner disc material. Disc problems are typically, not always, but typically aggravated by flexion, meaning bending forward. That's why people that sit a long time, that bend forward from the waist, many times that's when my back hurts me. I've been sitting a long time, compressing and flexing the disc, or I'm doing activities where I'm leaning forward, trying to pick something up or even reaching for something, and my disc is irritated. The flexion effect, or bending forward, helps to take the inner disc material and push it backwards, and that pushes into the bulge. It pushes into the protrusion, the herniation. It causes more nerve irritation. So extension, or bending the spine backwards by increasing the arch of the back, actually has the opposite effect. By bending backwards, we compress the back of the disc and we drive that herniated material, or that bulging material, and we drive it forward, back into its center position, oftentimes relieving back pain symptoms as well as leg symptoms. So we're going to combine this with our backwards walking that we know increases multifidus and erector spinae muscle activity. Both are extensors. And again, it's been shown that extensor training of the muscles of your back, especially for endurance, meaning longer times, has beneficial effects for low back pain of all types, including disc problems. We're going to combine walking backwards with walking uphill. You get both effects. Number one, the pelvis drops down and you have a slight extension of the back, which helps to push that disc material back into a neutral position. And number two, you're getting the second effect on the muscles. The extensors, the multifidus, the erector spinae are getting much more of a workout walking backwards than they are in normal walking. So after walking even for 5 or 10 minutes, you've given yourself a stimulus to relocate disc material, to help stimulate atrophied muscles and weakened muscles. And if you give yourself enough rest and you progressively increase the amount of endurance time, meaning how long you walk backwards uphill, over the course of weeks and months, you're going to be setting into motion a great healing stimulus for your disc problems. Number one, the multifidus and the extensor muscles are going to start to increase their strength, their size. Number two, you're going to be having more time spent with driving that disc material back into the center of your disc, oftentimes relieving lower back pain symptoms and leg symptoms. One word of caution when walking uphill: if the angle is too great, meaning if there's too much of a pelvic drop or too much curve in the back, it can compress certain herniated materials as well as stenotic areas of nerve compression. So if you do feel symptoms, you can tweak that by simply holding your tailbone slightly under or pubic bone up, rocking your pelvis into a posterior pelvic tilt slightly, not fully, but just enough to relieve the symptoms as you maintain backwards walking either on treadmill or outside. If you like this video on backwards walking uphill, check out our channel. We got a lot of great videos to help with disc problems. Questions or comments, write in. As always, I'll do my best to answer. Thumbs up to help me share this valuable information with others. And remember, if you're looking for great programs to help design a simple rehabilitative program to analyze your body mechanics and why is your disc being irritated, what posture and movement and muscle imbalance and stability issues are unique to you, because every back pain patient is unique, and that's why rehabilitative programs must be tailored to get the best results. Check out our programs at painfreeandfit.com. We've got the Fast Track program for degenerative disc disease that has all the exercises and analysis in there for you to do these exercises at home. And we also have the Walk-Away Back Pain program, which is filled with analysis and all kinds of walking exercises plus supportive exercises to help with degenerative discs, herniated discs, and bulging discs.